Good day everyone, my name is Cassidy Da Costa and today I'm here to demonstrate how to wrap medical devices using the envelope method. When we're wrapping medical devices using this method, we are selecting the packaging material on a couple of factors. We want to look for the size, weight, and shape of the item being packaged, the method of sterilization, and the use of the item being sterilized. It's important that we look for these factors because if the wrapper is too big, it could, for example, inhibit the penetration. And if the wrapper is too small, it could result in a too tight a wrap job. This could damage items due to overcrowding. For my demonstration today, I'm going to be using a blue cloth-like material. However, cloth is a material that is seldom used within the MDR. Its thickness of the material, it impedes on the penetration and it doesn't allow for removal of air. So what they use in the MDR is a blue wrap made of non-woven fabric. It's what commonly used in that department. I'm now going to show you the envelope technique. Now the envelope fold is more commonly used for smaller instrument sets, packs, and individual items. For my demonstration, I'm using the small box here. I have labeled it as a small instrument set, and for example, I have put OR trauma set. Step one, we want to be checking our wrap for any tears, lint, hair, any of that. So that's what I'm doing here. As you can see, there's no tears, no hair or lint. We want to do this because hair and lint can harbor microorganisms, and this will impact sterility. It's also important to check for tears as it can affect the sterilizing process, making it not sterile. And once we have got that figured out, we're going to do step one, which is putting the cloth in a diamond shape. As you can see here, I have done that. We want the bottom corner pointing to the front of the table, which it is. Then step two, we will place the item that we are wrapping, which I have shown you, in the center of the wrap. 3, we will then place a chemical indicator. This is my example here. And we will place it inside for my example. Please note that there is different types of sterilization that can require different types of indicators. For my example, I had placed it inside, but it can go both inside or outside. There's types of chemical indicators that will undergo a chemical reaction, and when in specific sterilization conditions, the reaction usually causes a color change. For example, I will just say that it could turn this color or any other color. For my demonstration, I have used the paper strip, and this is designed to react to steam chemicals, plasma, or gas exposure. And when using the paper strip, it is placed inside every package, pouch, container prior to wrapping the contents. We will then begin with step 4, which is taking the lower corner and wrapping it fully to cover the item. We want to then bring this tip back, and we are forming a tab. This will help later when we open the pack, so it can be opened aseptically. Aseptically is meaning that the technique will minimize the introduction of microbial contamination, and it will just be easier to open as well. Then we are taking the left corner here, and we are bringing it over the pack, just like so. And we want to form just another tab here, creating a little tip, like so. We're going to go ahead and do the same thing on the right side here, bringing it over. And again, we're not wrapping too tight or too loosely here, just so that it doesn't react to any penetration or cause overcrowding. And we're bringing this tip back yet again. So you can see it's created another tab, again, making it easier to open and following that technique. Then we want to bring the top corner over the entirety of the package, like so. And we are tucking this underneath the item. So going underneath the left and right folds that we created. And again, we are leaving yet another tab. This will create it so that it's easier to open yet again. And as you can see, it is tucked underneath, so it will not open. So we can open it that way. Beautiful. So next we want to secure the package, which would be step 8. We, for my demonstration, are going to be using regular duct tape. However, what's used is chemical indicator tape. The purpose of the chemical indicator tape isn't to verify its sterility, but it is to detect the potential sterilization failures, such as incorrect assembly or packaging. It also will show if it has been compromised or opened as well. So here we go. We're going to take the package here and just secure it like so. And again, we'll use this side here and do the same thing. So we have the tab and the tape. The final step is step 9, which we will be placing a label on the package so we know what it is. For my example, I have created this. What is on that label is the package information, the load number, date of sterilization, sterilizer number, and the identity of the person who has assembled it. I have used my initials as the technician. This is the sterilizer, lot number, code number, date, and this is just stating that it is a small instrument set. As I stated earlier on the box, I put it as an example of an OR trauma set. So placing that there.